Hello, my name is Rosie. I am a senior in business management, and I'm going to be doing my presentation, my nonprofit research analysis on the Wichita Falls Community Health Center. It's a clinic that I did the learning service project with. All right, so going over the agenda, I'm going to be going first over the history, mission and vision, programs, best practices, an assessment of the nonprofit based on those best practices to give examples, recommendations, and then end with a conclusion. All right, for the history, the Wichita Falls Community Health Center was founded in 1992, and they were basically focused on underserved residents in North Texas, which is people who are uninsured and underinsured. They started with very modest beginnings in their 3,800 square foot facility, which started with one physician and 8 employees, which expanded to a 44,000 square foot campus equipped with all sorts of clinicians for every service that they provide. And they provide lots of services, including x ray, pharmacy, education, prescription assistance, and Medicaid support. All right, and for this timeline at the bottom, this is basically just a timeline outlining all the different clinics that they built and how they expanded over time. So in 1992, the first clinic was established. This was a temporary clinic. In 2009, this temporary clinic was established. And in 2010, the Juarez Medical Clinic was built in Wichita Falls. In 2014, Phyllis Hiraki Dental Clinic was established in Wichita Falls as well. And then in 2017, the Family Healthcare Center at Virginia was established in McKinney, which that's where I'm from. And then Sunday, there was a clinic established at Sunday and Vernon College. In 2021, there was a clinic established in Will Barger General. And then in 2023, a women's health center at the Denver campus was established. All right. So, mission and vision of the Wichita Falls Community Health Center. Their mission is to provide access to high quality, respectful, and patient centered primary and preventative healthcare services for everyone. And their vision is to have a community healthcare center that will eliminate health disparities and inequities in our community by being the provider of choice for primary medical, dental, and behavioral healthcare services. And these will be reflected in the programs offered that I will be explaining next. All right. So, the healthcare center provides primary care, medical services. They have about 15 services that include x ray, family medicine, and lab tests, and 12 more. And they accept and welcome all sorts of insurances, Medicaid, Medicare, CHIP, and TRICARE. And they also have a sliding fee, which is based on family size and income, regardless of insurance status. And they also provide the no cost medical service, which is a program which may be able to provide eligible patients with services with a copay or no pay cost. And they also have additional services like dental, that provide cleanings, exams, extractions, fillings, and sealants. And then there's also counselors for children and adults, which they provide 20 to 30-minute sessions, offer referrals for mental health issues, weight management, and more. And they have health education on illness and disease, nutrition, diet, and exercise. And they also have outreach services that provide screenings and education, case assistance, and more. And they have a nurse family partnership program where a nurse will basically help mothers and children, like first time mothers and children, to make the process easier from a woman becoming a mother. And there's a read and outreach program that encourages children's literacy, as like every time that they come in for a checkup, they'll provide books for them to read to encourage literacy. All right, for the best practices that I will be discussing today are governance, transparency, community engagement, financial sustainability, and accountability. Okay, so for governance, I got this from the Board Source website, and it explains governance as how nonprofit boards are qualified and equipped to do their service to the nonprofit profit and do it well. So this basically just spans over meeting attendance, term limits, strategic planning, budget approval, chief executive job decisions, chief evaluation, and audits. So, the Wichita Falls Community Health Center that I worked with had a handout called The Roles and Duties of Board Members, which basically outlined everything that was on this source on the Board Source website. Like the term limit, which is 3 years, and they can have they can be voted up to 3 times, so they can be on the board for 9 years, and then there has to be like a 3-year lapse before they can get voted in again. And each committee has a chairperson and 2 to 4 qualified members to that specific committee. So they do have qualified board members, and they have a board handbook to follow these bylaws. Yeah. The next one is transparency. So transparency is just building trust with patients, donors, and the community. And the Wichita Falls Community Health Center does a good job of this by publicizing their forms, which I found the Form 990 and 501c on GuideStar. And this basically allows donors and the public to see like where the clinic gets their funds from and what they do with the donations. And they're also they have a notice of privacy practices page on the website, which basically just clarifies like the responsibility of the clinic, what they do with personal information, the rights of patients, and actions that might be taken under certain legal circumstances. And it also has a code of ethics and provides access to everyone without bias, which is a good example of remaining transparent to the community. And they also provide outreach services to make sure that everyone has access to their services. All right, community engagement. So, I got this from the National Council of Nonprofits. So they have obviously grown in the community because they have 30,000 patients today, which is a big growth from what they began with. And they offer a wide range of services to respond to everybody's needs. And they have a large staff. They have large staff and volunteer opportunities. All right, financial sustainability. I got this from the National Council of Nonprofits. So they have multiple sources of funding, which relies on basically grants, Medicaid, Medicare, reimbursements, and donors. And there's also a sliding fee, which and it is affordable. So it does have published financial reports. All right, so some recommendations that I would make is basically just to provide easy access to public forums, because I did find the Form 990 on GuideStar, but I couldn't find it on the website before. I think that would make it easier to make the relationship between the clinic and the donors stronger. Second one is metrics. I think it's important to measure the impact, like positive outcomes on patients, reduce visits. This can increase transparency and improve transparency. And the last one would be to diversify funding sources. So the expenses slightly succeeded revenue in 2024, and I think it would be helpful to diversify funds like partnerships. All right. And so, in conclusion, um, just reiterating the mission and just how the governance, transparency, community engagement, and financial sustainability um, are just reiterating the mission. I'm just going to reiterate the mission, and I think that if the Wichita Falls Community Health Center made these changes, they could increase their success. All right. Thank you.